Hello, everyone. Today we are going to be talking about my patient. We are going to call her Whispering Springs. She is accompanied by her two daughters, whom we will call Tulip and Rose. Whispering is an 87-year-old widow who lives at home. She lives alone and enjoys gardening and tending to the birds in her yard, as well as rock hunting. She was seen in the office for complaints of nausea, weakness, shortness of breath, headache, sore throat, congestion, cough, body aches, decreased appetite, and vomiting for 6 days. Whispering has multiple comorbidities, including hypertension, history of a TIA, history of cerebral infarction, hyperlipidemia, chronic fatigue syndrome, diabetes mellitus type 2, GERD, skin cancer, atrial fibrillation, atrial flutter, osteoarthritis, cervical spondylosis, lumbosacral radiculopathy, spinal stenosis, coronary artery disease, and chronic kidney disease stage 3. Whispering also currently has a dual chamber pacemaker in place. I chose Whispering as my patient for this project due to the multitude of comorbidities that she has, making her a complicated case. While I was talking with her, I came to the conclusion that Whispering is a stout and proud woman with a strong love and determination for her family. When talking with Whispering regarding the healthcare decisions already in place, I found out that she has had her healthcare decision documents in place for quite some time due to her extensive medical history. Whispering states that she has made some changes to her documents and her wishes over the past few years due to her increasing age and increase in the number of conditions that she has. As of right now, Whispering has her daughters as her healthcare proxies. She states that she chose them as they are involved in her healthcare extensively, and she has a strong, close relationship with both of them, trusting them to make sure that they follow her wishes to a T. Whispering did not appear apprehensive or uncomfortable with a topic or line of questions, as she states she has done this so many times. Both of her daughters, while present, were also cooperative and welcoming to the conversation overall. They both have been a part of this type of conversation before and are well aware of what her wishes are. The patient states she already has a living will and power of attorney on file at this office as well as her previous doctor's office. The patient was forthcoming with information, presenting no barriers to the completion of the conversation. Overall, the patient's goals are to be comfortable and pain-free until the end. She wants to continue with her current state of health, hopefully prolonging any rapid decline, but she is expectant that it is in the near future. Whispering states that she is willing to accept palliative care and hospice care, but does not want any life-sustaining measures to be done. Whispering is requesting in her living will, that should care need to be provided to her, that her daughters will have care brought to her home for as long as possible, and that she will not be placed in a long-term care facility or a rehab facility. A hospice home is an option when that time comes if it is needed. Whispering reports that she declines all orders for life-sustaining treatment, including CPR, intubation, blood transfusion, dialysis, artificial nutrition, hydration, surgery, hospitalization, diagnostic tests, and any further implantable cardioverter defibrillators. If her current pacemaker becomes problematic or is sustaining her through a difficult and irreversible illness, she would like it to be removed. As she states, she is a DNR and is going to keep it that way. As for medications, she would like to only have the current medications that she is on and no new medications other than pain medications or anti-anxiety medications. And this is to help with symptom management. If she gets to a point where the end is near, she would like to discontinue all the medications that she takes for condition control and only have medications that will alleviate pain and discomfort. She would like all her friends and family to have access to our healthcare information, except for her financial information, which should only be available to her daughters, which are her healthcare proxies. She believes that if her friends and family love her enough to be concerned about her care, then they should have that access to her information. Whispering is in total decision-making capacity and does not show any signs of being incompetent in making her own decisions. Concerning the palliative performance scale and the Karnofsky performance status, Whispering scored an 80 on both, displaying normal activity with effort and some signs of symptoms of disease. She can currently care for herself and only requires minimal assistance from her daughters for heavier duty household tasks. She has a full level of consciousness and has a normal or minimally reduced intake. She is fully ambulatory and performs her self-care and ADLs completely independent. Whispering did not change any of her decisions regarding her current living will or power of attorney with our discussion. She reports that our discussion made her decision to keep her requests the same firmer, wanting to be comfortable and surrounded by those she loves and God to see her through. She does request that when her time comes, that she has her favorite rock by her bedside. There were minimal, if any, barriers that I noted. The one barrier that I did note to be probably pretty significant with her care and her wishes is going to be the fact that she lives alone. This creates an environment of isolation. And although her daughters do visit her every single day, she does not have anyone available to assist her 24/7 currently. And this includes daily tasks, ADLs, and if anything significant or medical care would be needed, there is no one currently available for her 24/7. However, these are her wishes, and accommodations will need to be discussed for in-home care as her ability to care for herself declines. Moving forward, the only other concern that she had would be her ability to afford the care and services that she would need. However, her daughters are working on resources and looking at her finances to be able to promote her wishes for being able to remain at home through the end. At the end of our discussion, I came to the conclusion that Whispering is a strong and independent German woman who just wants to retain her sense of self through the end of her time. She has a strong support system with her family, friends, and her faith, keeping her going throughout the difficult times. She was very welcoming of our conversation, provided much information. She did provide copies of her living will and power of attorney to have on file so that everyone is aware of what her wishes are. She knows herself and she knows exactly what she wants. Thank you for your time today.